Well, Western New York's largest hospital is running very low on beds. Good evening and thank you for joining us. I'm Liam Stuck. ECMC tonight is at 96% capacity. What may surprise you is that despite skyrocketing numbers of new COVID cases in Erie County, COVID patients occupy a small fraction of ECMC's beds. To your side, Steve Brown has the story.
Governor Kathy Hochul has consistently defended the state government mandate requiring hospital workers to be vaccinated or lose their jobs.
Every single person who ends up in your care has the right to know that they are as safe as they can be.
But with area hospitals now running low on patient beds, there are questions about whether staff losses because of the vaccine mandate has played a factor here. West Seneca Town Supervisor Gary Dixon has his suspicions.
As far as I know, we're continuing with the program that if you're not vaccinated and you work in a hospital, you're going to be fired. In this circumstance, I don't think that's a good idea.
A spokesman for ECMC says the vaccine mandate is a factor, but not the factor. For starters, since August, 100 nurses have been hired and a total of 320 staff, making up for the loss of workers who lost jobs because they refused to be vaccinated. Right now, the hospital is licensed for 573 beds. 552 are full, and COVID patients total just 68, which is just 12% of the hospital's occupied beds. What would free up beds at ECMC are 60 patients deemed cleared for discharge, ready to go to a long-term care facility or nursing home, but because space cannot be found for them, they stay in the hospital. Another factor filling ECMC beds are emergency department patients. There's been a recent surge, some of it due to violence, including gun violence. ER wait times are way up. Normally, between 3 to 5% of people who arrive at the emergency department leave without being seen. Right now, it's over 20%. And over 80% of hospital admissions are people who arrive at the emergency department. Now, if hospitals continue in New York to run low on beds, Governor Kathy Hochul has authorized the state health department to limit or eliminate elective surgeries for a time to free up beds that may be needed for COVID patients. Steve Brown, Channel 2 News.